At least 4.4 million young girls in South Africa are currently living with HIV. This makes them 23% of the global average of 19.1 million young girls living with the virus. In South Africa, this translates to an infection rate of 1,300 young girls and women per week. This is according to a recent report. Joining us now to discuss the factors behind such a high incidence of HIV infections is the Soul City Institute's Senior Cluster Manager, Ms. Neli Hlope. Good to have you with us on the Daytime Update, Ms. Hlope. When we look at the infection rate, the numbers are quite alarming. But what are the factors that actually contribute to such a high rate of HIV infections among young girls and women in South Africa?
Good afternoon, Tammy, and the viewers. So I think at Soul City Institute, we're not really alarmed by these numbers, given the socioeconomic factors that affect a lot of young women and the gender inequalities that affect young women. So it's really a combination of factors that causes such a high incidence of infection. And one of them I mentioned is socioeconomic factors, where we see a lot of young women having relationships with older men because they provide for them or there is financial benefit, what we call transactional sex that's happening in our communities. But also the issue of schools not opening and the impact of COVID-19 has also had a negative impact, where young people have not had an opportunity to engage in some of the school-based programs that are being implemented in school. So we cannot also overlook some of the cultural norms in our communities that perpetuate young women to have relationships with older men. If you go to your rural communities, you still find young girls who are part of Ubutwala, and there are some of them who are made to be, wives at a very early age. So in those conditions, you find that young women become more vulnerable because they are not able to negotiate safer sex when they are in these relationships. A big contributing factor as well that we cannot overlook is the high rate of sexual violence in our country. So some of these infections happen when young women are being raped or they are being abused at home.
When we look at the global average, which is sitting at 19.1 million, South Africa's women and young girls account for 23% of that. Which other countries do we compare to? Which other countries around the globe have similar statistics to ours? And are there correlations that can be made in the very socio-economic conditions that you highlighted earlier on?
Tammy, if you look at the SADC, Southern Africa, for example, we in the region of Africa, we are one of the highest in the SADC region. So if you compare the statistics in South Africa, they are still higher than your other SADC countries like your Zimbabwe, Malawi, and Zambia. But the trends are quite similar because we have done work previously in one of our campaigns where we were looking at the infection rates, and we realized that some of the cultural factors, like your multiple concurrent partnerships, they contribute to the high infection rates in the SADC area.
We spoke yesterday, Ms. Hlope, to the Department of Basic Education, and we were speaking about the high rate of teenage pregnancy. And it dawned on me that not only are the young girls falling pregnant at school, but that also then would mean that they're not using any sort of protection. Did the study go into, I guess, the psychological factors as far as young women are concerned? Are they using protection? Are they using condoms, for example? I remember there was an era where, sexual education was quite, relevant, and it was in your face. But that seems to have taken a bit of a back burner now.
Yeah. As I mentioned earlier, I think the effects of COVID has really contributed to these numbers, even when we're talking of high teenage pregnancy. Because programs like Soul City implements, like the Soul Buddies Club program, where young people have an opportunity to engage and be given information over and over to try and, modify and change their behavior, it had to take a backseat because of COVID and children not attending school regularly. So, answer your question as well around condom use is that young people that we interact with, and the studies that have also shown that there's a low use of condom use. And I think it's because messaging and young people have not been exposed for the past year or even the past 18 months to such messaging. So we as Soul City will recommend that going forward and working with the Department of Education and the Department of Health, that we actually ensure that these programs are rolled out in all the schools in South Africa, so that young people are able to engage in and have these messages reinforced on daily basis, not just the curriculum part, but also the psychosocial support that they will need.
And how can, in just 1 minute, Ms. Hlope, how can young women be protected and empowered so that the rate of pregnancy and even HIV infection specifically, that declines?
Yeah, there's a saying that it takes a village to raise a child, and I think it's a combination of community interventions that we need to look at, but also at home, parents also need to be involved in educating their children around sexuality, and the programs that are already there in schools, your comprehensive sexuality education, the programs that we as Soul City are implementing, your Soul Buddies Club program, and the Rise Young Women's Clubs are quite critical. And I think for me, a very important part that we want to also recommend going forward is that such cases of statutory rape and abuse needs to be reported. And when being reported, they need to be followed through so that the perpetrators can be persecuted or at least account for their behavior. So what we've seen over the past year or in South Africa is that communities, schools, sometimes, there's no reporting and the perpetrators are left, unattended.
Ms. Hlope, you really are mentioning something that's so key there, that it has to go just beyond the events happening. It's got to be taken much further than that. Thank you very much for your time. She is the Soul City Institute Senior Cluster Manager, Ms. Neli Hlope. Thank you for that update.